Dr. Clem, my buddy in California. How are you doing today, brother?
Dr. Ehrlich, I'm on the northern part of El Paso, and you're in the middle of
You were
the
you were
country.
not going to let me
Texas.
get over that. That
No, the
I think that
question.
hurt your feelers.
No, it's helping me readjust my perspective of where I live. I want to be Texan, you know that, and I've been developing protocols in my life to improve that with my hat, my truck, my dog, my boots, my shirt. And I just went out and got some Wranglers because I was wearing Levi's. You know, Levi's are cool, but you told me I had to be a Wrangler. So you're
Yeah.
having a major impact on my life.
Okay, let's have our first Texan lesson then. If you're really going down this pathway, you got to say y'all.
Y'all.
There,
Well, how
hey,
is
that was
that?
pretty good. Hey, so
Y'all. Y'all. Yeah. Oh,
uh,
I need to be chewing something so I can spit, right?
yeah, no, you don't need to do that. That's
Oh, good. I've been
yeah,
practicing. I've been
yeah,
practicing.
yeah. We'll get you a horse too. Did you know I grew up in El Paso?
Yeah, I think you told me that. And
Yeah, that's where I was
also,
born and raised.
I know this about you. The cowboy boots that you're wearing right now are from El Paso,
That's
right?
right. Yes they are. They're El Paso's the capital of cowboy boots. Yep. So
And
anyway,
do I love my privileged information I get?
I've joked a lot about Texas and everything. I have a lot of pride in my state, and I think anybody wherever you
Right.
live, you
You
should.
should.
You
You
should
should.
absolutely. It's part of the United States culture, and Texans we play it up a little bit more than we probably
Yeah,
should. But
it's all about the Alamo.
yes,
it is right now. It's all about the Alamo. We're coming back from this thing, and we're going to win. We're going to win
yeah,
this thing, and sometimes you have to go to the bottom of your skill sets and find out what they are and build them back up. And I know our guest today is going to thrill you with her survival skill sets, and I'm looking
yeah.
forward to hearing about that.
Yeah, so we'll bring her up in just a second. As far as going back to Texas, I've got this little hobby where I go out and take
Yeah,
pictures of the Milky Way, and this is me at about 2 o'clock in the morning at the Llano
is that
River.
awesome?
Yeah, and this is right as Jupiter was coming over the horizon, and
Unbelievable.
if you look really close, you'll see a reflection in the water. It was just
Uh-huh.
a great time, and it's one of those times where I personally get to enjoy, the quietness, the
Mhm.
uh, opportunity to kind of reflect, and it's sometimes we have to put ourselves in those situations to actually
Uh,
force us to relax. I know that sounds crazy, but what do you think, James?
Todd, I'm looking at this right now, and just this picture takes me to a place of peace in my heart. And I'm sure that's doing that for our viewing audience as well. And I've really enjoyed what you've done with
Thank
your
you.
imagination and creativity. And it's an expression of who Dr. Todd Ehrlich is and all those skill sets you have. And, it's blessing people. I know your pictures have blessed me, and I want to thank you for that.
Well, it's blessed me as far as your dental skills. Your central the video you just posted today on with using the Mio system on your Emacs, that was spectacular. And
It's just a journey we live in right now. I think the way I'm keeping myself focused is building my skill sets. I have to stay busy. So if it's not doing this, by the way, this has really helped me. Thank you, Todd, because being online, talking to our colleagues gives me a focus. And I think I'm at that stage in life where I'm looking for ways to give back. They have always
good.
said when you hit about 50, your life becomes more focused on your purpose. Maybe that's about mortality. I don't know, but
Yeah.
I'm there. So
Well, that's a good segue into your thoughts. What do you got for us today on that?
this, what do you see?
Oh, hang on. You got ahead of me. Uh, the blanket that wraps us up. Something about that. Yeah.
Yeah, yeah. And, my wife and I go way back in our life. We started in fourth grade together, and I knew she liked me, and I didn't know how to let her know I liked her outside of sharing my lunch with her. But, 50 years later, I love what this says. It says the blanket that wraps us up in the warmth of life fulfillment. And during this time that we're in uncertainty, it's about going to your core values, the things that are important to you, the ones you love, the things you do, I've actually developed a new love for my profession during this downtime because I didn't realize how much I miss it. And that's my challenge to everybody today is rekindle your first loves of all the things that are important to you in life.
Yeah, that's awesome. It's so important, and we're all starting to come back. I know California is going to be a little bit longer. Texas, we are starting up pretty much Monday with some restrictions. But our next guest, Deanna Snitzer, they've been working already, and it's pretty interesting to hear what she may say. So we got you on, Deanna. How are you today?
There she is.
You look
Deanna.
beautiful. You are awesome.
Thank you.
Wow.
We need to have. This is the first time I put on pants in a month. No, I'm just kidding.
Yes. Well, okay. It's not that kind of show, but so. Deanna, tell us a little bit about yourself and how's it been being open? I need to practice with my handpiece to know how it is again.
Well, I am a general dentist in Lakewood, Colorado, which is southwest of Denver, kind of in the foothills area. We did a soft start this week. The governor allowed us to start, and then there were some issues with the board, and then he kind of backtracked, and then each county kind of made their own decision, and my county said, elective surgery, we're good to go. So we went. We did a soft opening, so we weren't at full speed ahead yet. We wanted to make sure that the protocols and new changes that we were experiencing were going to be going smoothly, so we gave ourselves some time to do that. And next week will be more back to normal, or whatever our new normal is, but we will be back to a more normal type of schedule. It went very well. I am very blessed that I have the greatest team to work with. My people, I fully believe, are the best people. My people are fantastic at their jobs. They care about their patients as much as I do. And that's our main concern, is getting our patients healthy, because we believe there's never been a more important time to have a healthy mouth and a healthy body. And we want to do that safely to protect ourselves, to protect each other, and to protect our patients. And we have come up with a lot of ways to do that. And that's why this week went pretty smooth. It was, there was a hiccup here and a hiccup there. And, there's always, starting something new is always difficult. But all of us were kind of looking at each other this week going, wow, this feels pretty normal. So we did good.
Deanna, you've already encouraged me.
Me too.
In our pre-discussion. And you're saying this coronavirus thing and what we've gone through is nothing because you've been through something. You've got to share the story of your survival and your attitude about life with what happened on a boat ride.
So it was in the winter. It was the day after Christmas in 2014. And I was in a very, very bad boating accident off the coast of Mexico. And I mean off the coast, in which the boat flipped upside down and pretty much sank. And we did not have any life jackets because apparently that's not as strong of a rule in Mexico. So we were kind of in the worst possible situation. There's three things in life you need to survive: air, water, and food. We had some water, but you can't drink it. And we had no food. And sometimes we had air, and sometimes you were underwater. So it basically doesn't get worse than that. And this was for an extended period of time. There was, searching that was going on. And eventually we got extraordinarily lucky and blessed. And somebody just randomly came and drove near enough to us to hear us screaming and picked us up. And since then, my outlook on things is very, very different. It made me a much less anxious person. It made me much more plan instead of panic. I don't panic, I plan. And it also told me that there is literally nothing that can happen to me in my life that could be as bad as that day. That was the worst that it can possibly get. And, there's sharks and there's everything. And nothing is going to ever be as bad or as stressful or as dangerous as that day was. And coronavirus is not as bad as that day was. So let's make a plan and execute the plan and deal with it. And that's just the way that I live now. It also made me much more likely to say yes to things that I want to try, because my point of view is, God, what if I'd said no to that thing that I really wanted to do, and then tomorrow I get another boat accident and I never get to do it. So I'm much more open to new ideas and new experiences than I ever was before. I'm much less timid than I ever was before. So there's two ways to deal with something that's upsetting or difficult or challenging or tragic. You can either go into yourself and be very, very sad and go in, or you can use that to build yourself up and go out and make a plan and help others and be a leader. And I made the decision to survive that day. And I made the decision during this difficult time to be a leader to myself, to my staff, and to my community.
Wow. Wow.
James, we're done. We're done right now.
We're done.
We don't. I mean, we literally don't even have to do another episode. I got chills just listening
that is
to that.
So powerful, and the way, because I know it's right in your heart, it's in your being, and what you shared with us on that, and I can't imagine that. Paul Holmley would call this a moment of clarity. We just all had a moment of clarity with Deanna. And you're passing that energy back on, and that's what we want to convey to others. So go back to your practice and tell us the steps that you've taken with the PPE on what you're doing. I think that would, even I want to know, because, I'm not open yet, but I'm looking for avenues, and I'm looking for what other people are doing, particularly a influencer like you, because we trust you, and we know that you have good critical thinking.
Well, the first thing that I did when this first started was I went into my little survival mode. I said, okay, my business is getting shut down. I'm not going to have any income. I need is just like in my boat accident. I need to save my air. What do I need to do that? With my practice, it was I need to save my practice. What do I need to do that? So for the first few weeks, I explored all of the economic options that were being available to us. I tried to lower my overhead so I wasn't having lots of cash outflow without any cash inflow. Me and my team had discussions. They were furloughed to a reduced hours situation. The Colorado Unemployment Office made kind of a thing on their website where you could say you had reduced hours due to COVID-19, so that if we were seeing emergencies and stuff, they could put in their hours and still get their unemployment. So I basically went into practice survival mode. What do I need to do to save this? Once things calmed down a little bit and we got over and flattened the curve and the governor started talking about reopening, my mode changed into what do I need to do to safely, comfortably treat my patients so that my staff is comfortable, I'm comfortable, and they're comfortable. And I went into reopening mode. Okay, what do I need to do? So I started immediately investigating sources of certified PPE. We all know there's a lot of fake stuff out there right now.
Yeah.
And I got a bunch of connections on that through other doctor friends that I have who are physicians. I have a friend who is the president of a large hospital system in the Denver area. I called him for advice. We actually have been talking a lot during this, and I hope that we will be able to make a connection through his hospital system on, maybe diabetic patients getting in with dentists and things like that. So I'm trying to make some of those full body health connections for patients in the future.
I want to work for you. I'm ready to quit my practice. I'm so inspired.
I've decided that I'm going to run for president. No, I'm just kidding.
Yes.
But so that was my next to go. How do I open my business in a way that follows the regulations that have been set for me and protects myself, my staff, and my patients? And I did a lot of research. My boyfriend accused me of being on my phone all day long because I was reading studies and going on OSHA and NEOSH and CDC 3-4 times a day to see the updates. And I ended up writing a document that was a best practices for dental offices. And it followed OSHA standards, their hierarchy of control. So starting with engineering controls, how do we basically keep actively sick patients out of the building? How are we going to screen them before they get in? And then it moved into administrative controls, which is how do we change our day-to-day function to respect social distancing and make sure that people aren't congregating in the lobby and things like that. And then I went into PPE controls, and that's basically set by the CDC and my local government. So I just followed the rules that they had already set. But through all that, I was realizing that man, this is a pretty good document and maybe I should give it to some people. So I posted it in my local Colorado group on Facebook, and I've actually created a group in Colorado. Me and another friend, a colleague in town, have created a Facebook group for Colorado dentists, and there's hundreds and hundreds and hundreds of dentists on there now. And we've been sharing all of our PPE. And oh, hey, there's a plastics company down the street in Denver that's making sneeze guards. If you want to order them from your office, they'll make them in 24 hours, and you don't have to wait to have them delivered. And if you want to, they make face shields. So if you need these face shields, and they have flippy up style, so they'll, they won't get in the way with your loops. And so all of us together as a community have been really supporting and lifting each other up, which to me was amazing, because in my opinion, most dentists seem to be fairly competitive with each other. But I wanted to create a space that was, this is our community. We are all in this. We are all in the boat. You know what I mean? We are all in the same boat. Right now, the boat's having problems. All the sailors need to work. All the captains of all the boats in the Navy need to get on the same team so that our fleet survives this problem.
Amen. And you know what? Yeah. Oh, go. I just this topic came up yesterday, and it's really kind of evolving as time goes on about how much community we actually have to do. And I guarantee if I was in your community, I would do whatever you say. You just tell me what to do, I'll do it.
Well, I don't claim to know it all, but I definitely feel comfortable in a leadership role, and I'm not a timid person. I don't mind speaking my mind about what I think is right. It's my opinion.
Are you sure about that?
I don't mind speaking my mind about what I feel is right, and other people are free to disagree with me. I don't have a problem with that either.
Yeah.
But if I think something should happen, I'm going to say, well, I really think that this is a great way to do this. Does anybody else have any other ideas? The more ideas and the more input we have as a community, the better. Yeah. And so that's the kind of space that I wanted to design for my colleagues, a safe space to say, hey, we're all in this together. Let's get through this together. And then in the future, this will be a great space for us if, when we're allowed to take our kids back to Disney World, for you to get some coverage for your office. Or if you have, a staff member that's moving across town and they're really good, but they need to move across town, and Colorado's a big state. Somebody's moving to Aspen and they're looking for a job. This person's great. If you're looking for somebody in Aspen, hire them. So I really wanted to make a really good community space for us to work together and band together, because there's always the more numbers you have, the more power you have. And there's
it almost seems like you're doing what your local dental association is maybe slacking on just a little bit.
Well, I have been in really close contact with our local dental association, and the members on the executive board of the dental association are in our group, and our dental association has been working their butt off. But to be perfectly honest, there are only a certain number of people in that executive board. There's a handful of them, and this is overwhelming. So I went to one of the members of the board who I'm friends with, and her husband is the president of our dental association in Colorado. So they're all in the same house anyway. And I said, how can I help you? Because I know that you are overwhelmed. They have 4 or 5 children. I can't even remember. And they've probably got to homeschool those children right now on top of all of their Colorado Dental Association duties. So I said, what can I do? I said, I used to work in marketing and PR. Let me make a press release and release it all over town so that the media will know what dentists are doing to protect their patients and protect their staff, and that we are planning and getting ready to come back. And I've done some interviews in our local community lately. You're my 3rd interview this week. So I got
awesome.
one. Great. I said, what can I do to help the image of dentistry become more positive and let patients know that we understand that they're uncomfortable, we understand that they need care, and we are doing everything in our power to come back to them to give them the care that they need. So that was one thing that I took over. And I used to work in marketing and stuff anyway, so it was a very natural progression for me.
Well, do you know how much you're loved? I'm getting some great comments here. I got to read a couple of these too. Hang on, let me go here.
Keep going.
No. Tom Levine says, hashtag UMKC proud. Thanks for sharing your personal story. Sarah Jochen said hello from Florida. And then there was, hang on. And then Jerry DeTulio.
Oh, Jerry is a community member here in Colorado. He used to be the mayor of Wheat Ridge, Colorado.
He's watching. He gave you a shout out.
Good. I'm
Yeah.
so happy. He's
Yeah.
wonderful. And he actually helped me get in touch with some people at the Jefferson County Public Health Department and the Colorado Public Health Department to get that best practices document into their hands. And actually, yesterday I was notified that the Colorado Department of Public Health, the CDA certified my document, and the Colorado Department of Public Health is going to be submitting it to all their providers through their provider
Oh,
relations.
wonderful.
So
Wonderful.
Jerry was very instrumental for
Oh,
me
cool.
in helping me help my local community and help the dentists in our community. So I'm really glad that he's able to watch. And someday I think Jerry will run for governor, and I told him I'd be his lieutenant.
There
Nice.
you
Well,
go.
I'll vote for him. He seems like a good guy.
He's a great guy.
You've got the energy. Deanna, would you just mind doing a walkthrough? Okay, patient screening,
Yeah.
what you're doing to move your patients within your practice, and what are you doing in your clinical theaters? Just big picture of what you've done now prior to coronavirus. What's the
Sure.
big changes? What are the big pictures? I think that
And
would really help our
I'll be
viewing
happy
audience.
to email you guys that document if you want to provide it to all your
Oh,
viewers after you
That
can
would be
link to
that
it.
would be
Absolutely.
awesome, and I want to be part of your Facebook group.
Sure.
You know?
Well, you're not in Colorado when we are screening, but I'll ask everybody if I can make an exception. So, so before this all started, I have a regular practice. I have my own property. I own my commercial property. So I have my own parking lot and I have a building. I have a smallish practice, honestly. I have 5 operatories. I'm the only dentist in my practice. So it's pretty traditional, small business dentist practice. I have now I have 7 employees. Before I had 6. I've had to add a staff through this. I'll talk about that in a minute. So before we ran our practice fairly normal, patients would walk in the door, they would check in, they'd sit down in the lobby on the couch and pick up a magazine. And, we never had that much of a waiting time in our office. Our patients always give us good compliments about that, as I never have to wait. Sometimes when I show up early, they're ready for me. So I'm a time stickler. I hate running late. It's my pet peeve. So we don't run late in my office. So we never had too much of a crowding problem in my office anyway, because I'm the only provider. I have 2 hygienists at the time, and it's just not that crowded of a place. Other doctors who have larger spaces with, 10 providers are going to have other problems. But the plans that I wrote are very, they can be laterally changed. They can extrapolate to many different situations. So regarding intake, 24 hours before our patients come in now, we used to just send out our reminder texts and all that. Now, 24 hours before each appointment, we call the patients. We ask them the recommended screening questions. Have you been in contact with anybody with COVID-19? Have you had a fever of 100.4 in the last, couple of weeks? All the normal questions that every business is having to ask now, and those are on the CDC website. So I just copied and pasted that, and making sure that they're okay to come in. And we are also notifying them of our new procedures. When they arrive to the office, we are asking them to stay in their cars, and we are now using the parking lot as the waiting room. So that makes people very socially distanced. And I think it's kind of like a drive-in movie theater. I think coming back, by the way, if you have money to invest it in a drive-in movie theater. I think it's going to be a thing now. Anyway, so we are using our lobby as the waiting room. And as the patients arrive, they're either calling or texting. We have software where they can text us through our software, and it pops up on the screen in the front desk and let us know what they're there and what car they're in, so that my assistants aren't running around the parking lot looking for Mrs. Jones. Mrs. Jones, I'm here, I'm in a red truck. And then either the assistant or the dental hygienist goes out with their appropriate PPE on and takes the patient's temperature in their car, makes sure we're continuing our screening. Then they come in and bring them right into
Let me interrupt.
Yeah.
How are you taking the temperature?
Exogen temporal thermometers. I remember SARS, and I remember this starting in January, and I said, oh crap. And I said, everything's going to sell out. So I bought enough Exogen temporal thermometers for us. I bought a bunch of PPE back then. So I kind of was a little doomsday prepper, but it turned out to work okay. And we are using our temperature, our Exogen temporal thermometers for each patient. And according to the CDC, 100.4 is considered a fever. I will say that temporal thermometers in general run a little bit higher than an oral thermometer. So if you get a good temperature on a temporal thermometer, it's pretty conservative. You're pretty well safe. It's probably actually even a little lower than that. And each thermometer has its own instructions and will tell you this temperature tends to run a little high, consider this a fever. So just make sure you read the directions on whatever you have. So we, as part of our engineering controls, our goal is to basically prevent actively sick patients from coming into the office. Actively sick patients may need emergency dental care, but they may need treatment in a more hospital setting. And that's something that I am personally not able to provide, but I know dentists who are. And if they need an extraction in a hospital setting, I have oral surgeons that I have friends with who have hospital privileges, and we can get those patients the care that they need. But that's not the kind of, I don't work in a hospital. I work in a regular dental office. So that's my goal, is to keep my regular dental office functioning. So once the patients are brought in, they can prepare their payment in the car, either give the front office their credit card number over the phone, and we have, those amounts that we know that we need to collect, their copay or whatever that day. Or if they have cash, they can just drop it off on the front desk, right? We're going toward the treatment room. They don't have to stop and talk to anybody. Our goal is basically, it's unfortunate because I'm a very social person, but our goal is to minimize social interaction. Each patient should have a maximum of 2 social interactions, either their registered dental hygienist, and that's it, or their dental hygienist and me if they're due for an exam that day, or the dental assistant and me if they're due for a treatment in my chair that day. So we are trying to minimize the number of social interactions.
I'm sorry to interrupt. Where'd you come up with 2? I'm just curious.
That's just the minimum number that's humanly possible.
I see.
Yeah, the minimum number of social interactions they can have is 1. They see their hygienist and they leave. Yeah. They have to see one person face to face. The maximum number that I want them to have is 2. They're either their hygienist or their assistant and me. So they're either going to have contact with 1 or 2 people, and that's it. We don't want them sitting and chatting with other people. We've also requested that they don't bring any extraneous people into the clinic. Don't bring your family, bring your friends. If you are having a procedure where you need a driver, a surgical procedure with me where you need a driver, then we will bring the driver in with you, give them the instructions, and then during your procedure, we will request that the driver wait in their car or go run an errand, and we will text them when you're ready and they can come back in and pick you up. So one of the big things is we just, like I said, it's social distancing. We have a sign on the front door that says, respect our social distancing. I actually have a really funny sign. It says, keep 4 penguins away from each other. So 6 feet away.
I saw that on your Facebook site.
It's a really funny sign. But we're very, very social with our patients in my office. We are, our patients I get a lot of compliments. I have patients who tell me all the time, I never liked to go to the dentist before, and I actually like to go now. So when my patients see my penguin sign, they get our sense of humor, and they don't want to have a problem, and they don't want to make anybody else have a problem either. So Brilliant. The patients really, really cooperative. Our governor has ordered or mandated that anybody who is able, who doesn't have any, lung issues or breathing problems, is able to wear their own face covering, needs to do that in public. So our patients are coming in with their own face coverings. And, we've had to remind them, I got to fix your teeth, you got to take it off. But I got to take it off back here. And then they laugh and they're like, oh yeah, that would be really hard. So we've done our engineering controls to minimize human interaction, which is hard for me because I obviously love human interaction, but it's what we need to do right now. I was able to, from the place down the street, get a 24-hour sneeze guard, or the little plastic things everybody sees at the grocery store. And the company that did them down the street made them very nice. They sit on little acrylic blocks, and I made one for the desk and then another one for our consult room in case somebody needs a more private environment. And my staff feels very, very comfortable with that. And they are continuing to wear their face coverings up front, even though they have their own kind of barriers. So once we've got them in the clinic, our PPE has increased. Obviously, it's going to have to. I've chosen to use launderable gowns because the disposable thing breaks my heart for Mother Earth. The amount of things that we are going to be throwing away in the next few years and landfills really concerns me. And launderable gowns, I think if you can launder your gown, and I've always had laundry on site. We have never taken our scrubs home in our practice. I leave my work shoes at work. We leave our work clothes at work. The big joke in my office is we all roll it in our jammies and roll back out in our jammies and we change at work. But we don't want our PPE coming home. And if there is a germ on our PPE, we do not want to bring it home and infect our families. So we are washing everything at work using launderable gowns. We have scrub caps that are launderable. We have respirators that are on the approved list of respirators that I was able to obtain. They are hard to obtain, but if you order in bulk, you can obtain them. And we were able to do some bulk ordering through the group that I formed, because you have to order like 50,000 of the darn things. But if you got 700 dentists in your group, you can come up with that number. So through the community, through ordering together and bonding together, we've been able to overcome a lot of the financial and supply hurdles that some people who are maybe trying to do this all by themselves are not able to overcome. So I would encourage dentists in other states and in my state to join a group of your fellow colleagues, work together to solve these problems, because you may not know where to get sneeze guards, but your neighbor may not know where to get N95s, and you can work together and do that. So work together and do that, make it happen. Nobody is going to do this for us. Nobody is going to take care of this for us. We are the captains of our ship, and we need to right them and put them into the right direction and have the whole fleet on the same mission. And that's the goal that I set for myself and my community. And so far, we are exceeding it. We are exceeding all of the expectations that I ever had.
You've got a lot of love coming your way. Let's see, Matthew Standridge. Hey, lady.
Oh, he graduated.
And then let's see, we got Cindy Blaylock. Hey, girl. Hey.
Oh, yeah.
I don't think I said it quite in her voice, but
she probably said, "Hey, girl. Hey." I know she would.
So, Deanna, I had another question. So, between patients, are you folks changing your outer coverings?
If we are
on yourselves, on yourselves,
as much as we can, yeah. If we're doing a procedure that would be considered a higher risk procedure, yes. And we've ordered more lab jackets and everything, and just throw stuff in the washing machine. And there's been a lot of laundry, but that's the way it is.
Now, are you going as far as changing your lab coverings between each patient?
My lab coverings.
And in other words, your outer covering on you, because it's about contagious.
It depends on the procedure. Yeah. So if I'm just doing a consultation with somebody and they're sitting 6 feet away from me, and I'm just introducing myself, and there's nothing, I'm just having a conversation with somebody, then it's probably okay for me, in my opinion, to keep my same lab coat on. If I'm doing something that involves, work, then it's probably a good idea for me to change that. So one of the things in the document that I wrote was a categorization of procedures that I felt were high risk, medium risk, and low risk, and then corresponding PPE. So, if I'm just doing a check or a consult, I can just wear a regular face covering. I don't have to wear a respirator for that. It's no different than going to the grocery store, and I certainly don't have to wear a respirator at the grocery store. And every time somebody sneezes at the Kroger's, they don't fumigate the whole building. So I'm not too worried about that.
Yeah.
But if I'm doing something in a patient that requires, things getting wet or whatever, then I might want to, consider that a little bit more high risk. So I've tried to detail that for myself and my staff. And like I said, I'd be happy to provide you with that document. But, if I'm just talking to somebody like I'm talking to you, I don't think there's reason for me to change my coat. But if there's more going on, then I'm going to definitely consider that a higher risk procedure and take the precautions that are necessary for that procedure.
Let me ask you this question. So in Texas, we're getting ready. We can start at midnight tonight. So everybody's...
Yeah. That's an early day.
I'm
not a morning person.
I thought about calling in the team at midnight tonight, and we'll do a filling or something. But no,
I'm sure that would go over well.
Not at all. But anyway, so we're going to start actually on Tuesday, just to give a kind of a soft start next week. But one of the stipulations that we're having in Texas that they just came out with literally in 24 hours is that you have to, when you start a procedure, you have to finish the procedure before you can go see another patient. So
I find that interesting. I haven't heard that in Colorado. That will probably affect people, doing hygiene exams.
Exactly.
And it may be that you have to get people back for a periodic exam, or it may be that your patient might have to wait in the chair a little bit for you to finish your filling. I wonder if you could put a hook on your door. You could leave your lab jacket on your door of the procedure that you were doing, doff your PPE. change your gloves like you normally do, enter the treatment room where you're only doing an exam. It's not as high of a risk procedure. And then go back into your treatment room and re-don your jacket or disposable or whatever, take it off the hook and continue. So I think that the idea behind that is you don't want things spreading from room to room.
Yeah.
And I think as long as you followed that and you weren't spreading things from room to room, I think that could work. So in theory, that makes sense, but it's going to take some engineering controls.
Yeah.
Well, the problem with that is what you just said. That makes sense.
Yeah.
The problem is the wording is very specific. You cannot leave. It actually says you cannot leave the room and the key word is and go see or treat another patient. So we're kind of a little bit in limbo on all that. So, but we'll work it out.
That may be changed, and it may be up to your dental association to go back to the people who wrote that rule and say, hey, in orthopedics, this really, really works. In dentistry, this is a huge challenge, and this is why.
Yeah.
Or you may have to just make sure that each patient gets their exam right when they get there, have the x-rays and everything right when they get there, and then you go start your restorative. So it's going to be up to your schedulers to really work on your schedule and make sure that everything that needs to get done gets done according to the local law. I do think that maybe you should send a bunch of emails to the TDA and say, hey, Texas Dental, this is really going to be difficult in dentistry. Is there something that we can do with this new law that makes a permission for us to leave our PPE in the room with the patient that we're working in, go into another room with different PPE and see that exam, and then go back to our
makes sense.
It doesn't seem like you would be asking a lot, so I think it's something reasonable that could be amended.
That's exactly what they do in the hospitals. My brother's a physician. They're up managing this, and it's all about changing your garb from one location to another. And, on this topic, it's in the research I've done, and I've watched a lot of non-media research and I've spoken with a number of physicians. And the future of this is really about screening, because we cannot contain this virus. Now, we don't want to infect other people. We don't want to get infected. But if someone has it, it's almost impossible to contain unless it's under a very isolated protocol, as you'd see in a very top level in the medical field. So, and I don't know if that's even possible in our profession, but it's still going to come back to screening, particularly antibody screening. A lot of us have the antibodies already. And that's what they're finding with the early antibody studies. And it's going to be interesting to see how this works. I love what you're doing. My question is, how far overreaction are we going to go into that? How about like bacterial viral scavenging systems and your UV lights? What are you doing with that?
Well, we are using our high-speed evacuation as much as possible. And many studies show that if you're using high-speed evacuation, either isolite, high-speed, rubber dams, those kind of things, that aerosol production is extremely minimal. Mm-hmm. There's always going to be some risk, but we are going overboard with our PPE to make up for that risk. Right. In my office, I'm very fortunate, we have giant picture windows in every single operatory. And we've opened the windows, opened the door. We have excellent airflow through and the patients are loving it. We have a huge garden outside my office as well, so we can hear the birds and the flowers. There was two problems. There was one big problem this week with that is a chickadee flew in the window. And my hygienist, I heard her in the other room go, ah! And I'm like, you okay? And she goes, there's the bird. And it landed on a picture frame in the corner. And then I opened the window really big and it flew back out. So the worst problem we've had with the airflow is there's a bird in the office. And then there was one bumblebee and we just shooed him back out into the garden. But other than that, keeping the airflow is very important. In my office, I'm fortunate we can do that naturally. In other offices that may be in large office buildings, they may need to promote some other sort of airflow and filtration, but fresh air is the best. So you can't get better than fresh air and sunlight. And that's been shown through every pandemic or every respiratory pandemic in history is fresh air therapy is the best therapy there is.
And we know the air is the best in Colorado. And it's just true. So you know, I've been processing this. I can be in your group because Todd said that you're actually in Texas and I'm in Texas because I'm in El Paso. So we're all basically in Texas.
Colorado was part of Texas. Yes.
That's true. I did used to live in Oklahoma, so that's pretty close.
Close enough. Close enough. Hey, Deanna, you're getting some questions here.
Sure.
So let me go to Adam. Adam Nolte, he's one of our colleagues that we've interviewed. He's from the UK. And he says, please ask Deanna how many people you see per day. Has it reduced, or is it just organization of the patient in their transit, like you've said? Great work, by the way. Like, are you limiting the amount of patients you see in a day?
Well, we are limiting the amount of patients in the building at one time, and we really worked hard on our schedule to make sure that we had adequate time to clean in between rooms and make sure that we're doing that. And as I said, we did a kind of a softer opening this week to see how that went, and it went very well. So our goal is minimize patient interaction. In my office, we have individual treatment rooms, so I don't have bays, open bays, and that makes it much easier because the patients are separated. They're well over 6 feet from each other, and there's walls in between the patients. So if each patient is in their treatment room, it's basically keeping them isolated with their one provider or maximum of 2 providers in the room at a time. Offices that are having open bays, they may need to rearrange a little bit. They may need to see what they need to do to take out a middle chair in between if the chairs are very close together, or they may need to put up some sort of a temporary plexiglass barrier in between their operatories to keep any things from, going other places. So there's a lot of options for that, and every clinic is different. So every clinic has a different layout, has a different number of operatories, has a different setup. So it's going to be really, really crucial for each provider and each practitioner to really look at their space, design their space to be as safe and comfortable as possible for these people. And if that means making engineering controls like moving a chair or building a barrier, then that's what, or putting in a laundry, that's what needs to happen right now. And it's an expense. There are expenses to engineering controls, but they are upfront expenses that over the course of your time here will lessen other expenses.
We have a question regarding that, actually, from Brenda McNulty.
Oh, Brenda, hi.
Well, wave her at her again. I'll let you. There we go. That was better.
I'm sure she'll text me after this.
Wait, let me go back. I took her off. Hang on. Okay, so Brenda McNulty says, are any of you charging an additional fee for the PPEs or getting additional reimbursement for the PPEs from insurance?
I am not a participant in very many insurance plans. I have just chosen not to do that with my practice. I will say that, in my opinion, that is between the provider and their insurance company. That is something that's part of a contract. And if the contract states that they will not pay that and that you are not allowed to charge your patient for that, depending on your state or your area, it may not be an option. I have chosen in my practice not to do that. Yes, did I take a financial hit doing all of these engineering controls, administrative controls, and PPE controls? Yes, but I consider that an investment. That is an investment in my building. That is an investment in my practice. That is an investment in my staff's safety, and that is an investment in the safety of myself and the safety of my patients. And as a doctor, those are things that are my responsibility. I am not going to ask my patient to pay for my safety and their safety. I feel like if they are going to come to me and they trust me as their doctor, they are going to expect me to do what's right. So I have not chosen to charge my patients for any of this. I will tax deduct all my equipment the way that I always have. I will tax deduct my PPE the way I always have. And maybe somebody someday in the government will increase the tax deductions for that. Jerry, if you're listening and you have any government connection, if you would like to have the governor of the Colorado let us take a larger deduction on our equipment and our engineering and I think that would be wonderful if somebody wants to tweet to Trump and do it. So I have a feeling.
Deanna, did you say what year are you going to be running for president?
Yes.
We want to get this flow now.
My plan is Snitzer 2032.
There you go.
Nice. I'm writing it. I'm going to put it down on my sticky note. I'm voting for you, no matter what.
There's a little flag. I'm going to wear a flag pin there too.
We will volunteer for you.
I appreciate that.
Deanna, Matt, I have enjoyed listening to you. You are a breath of fresh air all the way up from Colorado, and wow, I will follow you on Facebook because I need to know everything you say. What do you think, James?
Well, I appreciate your critical thinking. I appreciate most of all your attitude. You have an attitude that we all need because it just resonates, and you've been a huge blessing to me and our audience today. I just know it. And what I would advise our audience is share, 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 share. Every dentist in the country needs to know that Deanna's running for president, and that she has good critical thinking. And
Yes.
and now's the time. Your messaging today was just what we need, and you're giving us hope. You're giving us a pathway. You're brilliant, and thank you. By the way, can you show your dog to us? Your dog.
Oh, there he is.
Come here, buddy.
Oh,
there
cute.
He's so cute. Can you get up? You get up.
Come on, let's go. Oh,
That's my
there we
dog.
go.
He got to come to work with me a lot when I was seeing emergency patients.
Yeah.
And now he wants to come to work with me every day. So we're going to have to work on that. But
I take my shepherd to work every day. He's actually a licensed working dog, but he puts his vest on as part of the protocol. Yeah. He sits in my private study so patients don't know he's there, and the staff love him, and it's kind of like this connection. And if I'm having like a tough day or I need a little emotional care, I just go in and pet my dog, and he just gives me the love I need to go on to the next procedure.
He's my best buddy, and I'll say my patients that came in for emergencies, I was like, do you like dogs? And they're all like, yeah, because Colorado, everybody has a dog. So I'd let them come in and pet him, and they'd give him a hug. So with regard to what you said earlier, one of my philosophies that I live by is you don't always get to pick what happens to you in your life. Things happen. You don't get to choose. You get to choose how you react.
Right.
You do not get to choose coronavirus existing. You get to decide how you react to that. And I think that those decisions for people are incredibly, incredibly important. I've chosen to lean in, help my community, try to be a leader. And if everybody made that, a decision for that like themselves, we could all really work together. So like I said, we can't pick that this happened. We don't get to decide when bad things happen in the world, but we absolutely have control over our own actions and how we react to these situations. And I hope that everybody chooses to learn and grow and become better on the other side of this than they even were before.
Yeah.
Oh my gosh.
That is
amazing.
The perfect. Thank you, Deanna.
Deanna, thank you so much. We are just so honored that you came on today. And how can people find you on Facebook? What is your group? What is the Colorado
our Colorado group is the Colorado Dentists Only group, but there's dentists in Colorado that would like to be a part of that. I am on Facebook. My name is Deanna Snitzer. The picture that you guys used in your advertisement for this show is the picture I have on Facebook. I'm in Lakewood, Colorado. My website is coloradoadvanceddentistry.com. So if you want to know more about my practice or just how we do things around my office, feel free to take a peek at that. And like I said, you can feel free to contact me on Facebook with any questions or concerns that you have for your own practice. I've had a lot of dentists asking me questions lately. I have a degree in communications, so I've had a lot of dentists ask me, how can I talk to my staff about things? I'm happy to give you advice, and my fees are pretty low. No, I'm just kidding. I'm happy to help you out. I'm happy to help you out and do what I can to help us as a community of healthcare providers, because that's really what we are.
You're amazing.
You're awesome. You're
amazing.
Thank
you so much.
Thank you so much for coming on, and wow.
Thanks, Deanna. Well, James, wow. Oh my gosh. How are we going to beat that? I mean, that's exactly what we needed right now, right?
That's one of the best interactions I've had in a long time, and the energy she conveys and the mental processing and her communication skills is all to be admired, and she's blessed us. I'd like to just emphasize that our viewers need to share this link, share with your friends if they're in the dental profession, or if they're not, they need to know what Dr. Snitzer is doing, because I think it's going to lead the way for our viewing audience. So I want to thank her for that.
She was awesome. I just blown away. I got chills through some of her her boat story. I mean, that's just amazing, and what a life event that she had. So luckily, we all don't have to have life events like that, but we can live through others' examples, and that's definitely a good one for us to remember. So
we want to lift her up today, and she's the type of leader that we need in our profession, because she has good communication abilities, and she also has incredible critical thinking, and that's what we need. Yeah.
Hey, and we have one of her very good friends.
Yes.
I didn't even know this coming up just right after this. Dr. Erin Elliott. She's been watching, so thank you. Oh, by the way, she had a good shout out. She said, "Amen, sister."
Amen.
So
there you go. Yeah.
All right, so we're gonna sign off, and we're gonna be right back here in just a minute with Dr. Erin Elliott.
Actually, we're back in about a half an hour, right?
Yep. Yes, we are.
Okay.
Yes.
See you then.
Thanks.